Hey, what's up everyone? Welcome to Asylums Uncovered, where we discuss the influence and impact of state hospitals on American history and the void left in their absence. I'm sure you've heard of the term lobotomy, but do you know the history behind it? Dr. Walter Freeman coined the term, refined and promoted this procedure for nearly 4 decades, beginning in the 1930s. Freeman is arguably one of the most polarizing and infamous medical figures of our time, but what is the story behind the lobotomy and the man responsible for its popularity? If you're listening to the audio-only version of this, the video version might be better. This episode is pretty information heavy and due to the topics, and the visuals may just help make it easier to follow. I'm going to split the episode up into 2 parts. Part 1 will be all about Dr. Freeman, and Part 2 will be all about the lobotomy. And you'll want to watch this episode first, but I will put a link to Part 2 in the description below. Before we can talk about the lobotomy, we first have to discuss the man at the forefront of it all. Dr. Walter Freeman. And it's critical for people to understand who he was and his background because it does pertain to how the lobotomy became mainstream. I've read a lot about Freeman over the years, and there's a ton of information out there about him, and a lot of it is inaccurate or difficult to follow. So I wanted to take all of that information and put it in a condensed, easy to follow version. If you're interested in learning more beyond this podcast, I highly recommend a book called The Lobotomist. It's a biography on Walter Freeman that has incredible detail. Walter Jackson Freeman II was born November 14th, 1895 to parents Walter Jackson Freeman I and Corinne Keene. Corinne's mother was actually a distant cousin of Lizzie Borden. You know, the Lizzie Borden who was accused of killing her parents with an axe in 1892. That has absolutely nothing to do with the lobotomy. I just think it's a really interesting fact. The eldest of 7 children, Freeman never grew close to any of his siblings or his parents. His dad was really shy, awkward, and never outwardly showed love and affection to his kids or his wife. Corinne, however, was very loving and supportive, but interestingly, after she passed, Freeman confessed that he never even loved his mother. I'm not entirely clear why this was, but this family seemed to have some dysfunction. The family lived in Philadelphia, Pennsylvania, in a neighborhood full of wealthy doctors. Growing up, Freeman was around medical professionals who were very well respected. Philadelphia was considered the birthplace of American neurology and psychiatry, with top-tier medical schools and physicians. His father was an ENT, or ear, nose, and throat doctor. He didn't love medicine and wasn't known to the wider medical community, unlike Freeman's grandfather, W.W. Keene. Keene was a famous neurosurgeon and would eventually be president of the American Medical Association. He accomplished quite a lot in his career. He operated twice on President Grover Cleveland. He became the go-to surgeon for many other presidents and their families. He was part of the team that diagnosed FDR's polio and was the first American surgeon to successfully remove a brain tumor. So, yeah, his resume was quite impressive and he was very well respected. Keene retired in 1901 but was still active in the medical community. He became close with Freeman and had great influence on him. And I bring up Keene and his accomplishments because, to me, he was the inspiration for the push of the lobotomy, because I think Freeman wanted to be viewed as this juggernaut in the medical field, just like his grandfather, and the lobotomy was a way for him to do that. Growing up in school, Freeman was kind of awkward, just very shy, unathletic. He never even dated until he was in medical school. And as a teenager, he was very interested in photography, which would later come in handy as he took meticulous notes and photographs of his patients. Graduating from Yale in 1916 at the age of 20, Freeman enrolled in medical school that fall at the University of Pennsylvania. By his senior year, neurology was his primary interest and focus. And for anyone who doesn't know, neurology is the study of the nervous system. You have your central nervous system, which is your brain and spinal cord, and then you have the peripheral nervous system, which is more sensory focused, like your eyes, ears, skin, things like that. Neurologists treat issues like strokes, Parkinson's disease, and epilepsy, just to name a few. Freeman was interested in how the brain, the nervous system, and neurological disorders all connect. He did very well in medical school, graduating second in his class in 1920. In February the following year, he began his internship at the University Hospital in Philadelphia. Freeman was so fascinated with neurology and neurosurgery. However, he come to find out he actually didn't have an interest in surgery. In fact, he said it bored him. And this is really important to remember, especially once we start talking about the lobotomy, a brain operation, because Freeman was never trained as a surgeon, but yet he was doing surgery. And we'll talk about that more in part 2, but it's really important to know that only a neurosurgeon can and should be performing surgery. Freeman worked as an assistant pathologist before graduate training in Europe in 1923. And while he was overseas, his grandfather was pulling strings to secure him a job running a lab at St. Elizabeth's Hospital in Washington, D.C. And there was a lot of administrative work with this role, something Freeman wasn't thrilled about, but his grandfather was going out on a limb for him, so he felt like he needed to accept the position. Opened in 1855, St. Elizabeth's Hospital was first called the Government Hospital for the Insane. It was built following the Kirkbride Plan and boasts beautiful Gothic Revival architecture. Initially operating as a military institution, the hospital saw many different types of patients throughout the years, ranging from Civil War soldiers to the insane to tuberculosis patients. Freeman had never heard of St. Elizabeth's, despite it being a highly regarded psychiatric institution. And today, St. Elizabeth's is still standing. I believe Department of Homeland Security owns the building now, and they've either converted or have plans to convert it into offices. Freeman arrived to D.C. in July 1924 at 28 years old and ended up working at St. Elizabeth's for 9 years. Freeman believed that breakthroughs in neuroscience would happen in academia, not mental asylums, so he took a teaching job at George Washington University in addition to his role at St. Elizabeth's. The university made him chair of the neurology department in 1926, and on top of that, he also had a neurology private practice. Shortly after arriving to DC, he starts dating a woman named Marjorie Franklin, and they marry that year after only knowing each other for 3 months. And by 1936, they welcomed 6 children. A daughter named Lorne, a set of twins, Franklin and Walter III, and 3 more sons, Paul, Keen, and Randy. And one thing Freeman always made a priority were family trips and spending time outdoors with his children. I think his connection with his kids was important to him because his own dad was so closed off. But tragedy would strike in 1946 as Freeman and his 2 youngest sons, Keen and Randy, were vacationing in Yosemite. Bending down by the river to fill his canteen, Keen fell in the rapidly moving water and went over the falls. And what's really sad is Keen wanted to grow up and be a surgeon just like his great-grandfather and namesake. Freeman earned his PhD in neuropathology in 1931. So a neuropathologist studies diseases of the nervous system. They're the ones in the lab analyzing tissues taken from a biopsy or an autopsy. Wanting to focus mainly on his private practice and position at George Washington University, he resigned from St. Elizabeth's. Freeman also helped create the American Board of Psychiatry and Neurology, which still exists today. And to become board certified, applicants had to show competency in both fields, as there was a lot of overlap between these 2 areas. As chair of the neurology department at George Washington University, Freeman wanted a neurosurgeon on the faculty, and the perfect person came to mind: James Winston Watts. The 2 had actually met in 1933 at a conference, and Watts made quite a lasting impression on Freeman. Watts officially joined the staff in 1935, and the 2 started lecturing together. Watts described Freeman as brilliant, a genius, and a showman. Freeman's lectures were very animated, and sometimes the students actually brought their dates to watch his demonstrations. His showmanship would continue into later years while he was doing lobotomies. Despite working together, Freeman and Watts couldn't have been more different. Watts was very by the book when it came to operating room procedures and sterilization, whereas Freeman was more negligent and almost careless. And this is important to remember because years down the road, it would create a rift between the duo as Freeman started doing his own lobotomies outside of an operating room. Freeman attended a symposium in London in 1935 where he met Egas Moniz, a Portuguese neurologist. And at this conference, there was a study presented about chimpanzees completing tasks before and after the frontal lobes of their brains were removed. Researchers looked at their overall temperament and decision-making skills. Moniz was so moved by the study, he wanted to do a similar procedure on human psychiatric patients in Portugal, a procedure that he would call the leucotomy, a precursor to the lobotomy. And who was right there as Moniz's biggest supporter? Dr. Walter Freeman, of course, and he made sure that he and Watts would be the first in North America to do the leucotomy. Now hop on over to part 2 because that's where I'm going to talk all about the leucotomy and how it shifted into the lobotomy.